I have another image I would like to play, but I don't know if it is appropriate or not. Let Mr. Johnson decide. I send you the message, see if we can see it. If it's not, I mean, this is also a young girl that has another type of cancer. You know, I think he played it. Yes, okay, so it's okay, it's not really a big deal. So if you look at this patient, it's a young patient, it's a young girl, okay, about maybe 19, 20 or so. If you look at her buttocks, like one side of the buttocks is normal size, look at the other side. Huge, okay, huge. And the mass is too big and too solid and too firm that is deviating. It extends all the way to the vagina now from the front. From the front it goes all the way to the vagina. That is deviating and covering the vagina. The vagina is shifted to the other side, to the smaller, to the normal side. The vagina is being shifted because the mass is too huge. The mass is too huge. So, you know, for this patient here, I seen her also about last week. And the question is, since how long you having this? Oh, 2-3 years. So I'm quite sure it didn't start that big. It is now that's so big that her buttocks is being disfigured. And we're not talking about lipoma here. We're not talking about something that is simple. We're talking about cancer. We're talking about cancer. That you see now, the mass is too huge. Disfigured her buttocks, but we don't care about the figure right now. We don't care about how the looks right now. We care about we have a big cancer, big tumor that has taken all her muscles. Those tumors, those cancer type, they grow in muscles. The muscles are all scattered. And next to the muscles is the bones, so it's going to be spread to the bones. My question is, this patient, did she come from a village? And the finances are not there. So they came to see what I think about this. Could it be fixed? Obviously, the answer is no. That's a big surgery, requires funding. And if somebody out there wants to help, please help. If you're blessed out there and you want to help this young girl that still have a lot of years ahead of her, and if you want to help her, God is great. Please do. Let's offer her some nice surgeons to take care of her and remove her agony, and she can live a normal life. You know, we have the surgeons in Cameroon. We have the professional team in Cameroon. Many hospitals, they have this surgical unit and it can easily be done and dealt with successfully. I heard even there is kidney transplants taking place in Yaoundé for the first time. So we have very advanced, very knowledgeable team of doctors that can take care of all these scenarios. I do not blame this young girl for being ignorant. You know, poverty is played a role on her. She couldn't go, and if she goes to those small local health centers. They don't know. But this is, by the first look, this is definitely cancer. So if somebody out there wants to help, let us know. So that's another form of cancer that has been ignored. Could have been dealt with easily when it was very small. Because you feel a lump there. You feel something is wrong. It's your body, and nobody knows about your body more than you. So when you feel something is wrong, you better take it serious now and do something about it before it's too late. And in this case here that we have seen is very much too late. It would have been much better to deal with this kind of case much earlier. Like I always said, early diagnosis equals to better treatment, better prognosis. Okay? So this is the case. I think that's enough for cancer. Let's move to something more light now. Let's do this lady with the kidney, because we've spoken before about the kidney. If we can share this video, and that's a cry out. And that's a cry out for everybody. If also somebody can help this lady, let's play her video. We have her consent to be shared in the media. So maybe somebody with a heart there can help her out. Let's play her video. So
So we have,
Immaculate Syriphobia.
yes, she has complete chronic kidney failure. No urine output, meaning she cannot urinate for how long?
For 8 months today.
8 months today. She's on dialysis.
Yes.
You do the dialysis
Yes,
twice
I
a
do.
week
2 sessions a week
in Bamenda.
in Bamenda.
She is in urgent need for kidney transplant.
Yes, doctor.
And we cry out for everybody out there with a heart
Yes,
to
doctor.
help.
Yes, doctor.
She's 42 years old, a mother of how many kids?
3 kids.
A mother of 3 kids.
The oldest is 14 years old
Yes.
and the youngest is 5
And
years.
she needs help. Contact me if you like to help save this mother. Thank you very much.
So we see this lady, that's a kidney failure. A complete kidney failure, as if the kidney is not even there. She cannot urinate, she doesn't urinate. Everything is done through the dialysis machine, twice a week. So there's no urine output, the kidney is completely shut. We scan the kidney, is nothing there, just a scarring tissues that is very hyperechoic in ultrasound look. There's no kidney there, no functionality, zero functionality. Now the question would be, what can we learn? What can we learn from this kind of case? And how can we, what advice can you give us, doc, regarding kidney? Routine check. Every time you feel that you have pain around the kidneys, if you know something, the urine is way too dark, is foamy, something is wrong with the kidney pain, you should rush to the doctor. Scan the kidneys, do urea creatinine, and see where you stand with your kidneys. I have said before about kidney stones, and we said a bad colon, a colon that need to be detoxed, is most likely behind the kidney stones. And we said a kidney stone means that the kidney cannot ionize the salts and the minerals, make them like iron, like soluble on water, and that mean the water mean the urine. The solids, the minerals, and the salts cannot be dissolved easily. The kidney lost the capacity to dissolve those sand and dust and minerals into the urine. It lost the capacity to ionize, and the problem most likely coming from the colon. We call that RTA type 1, renal tubular acidosis type 1, and when we do the urine analysis, we see pieces we call renal tubules cells inside the urine. We will see the potassium is low. So it's always that we do this combination, urine analysis, potassium, urea creatinine, to see what we have there. So that is very much advice. And when it's early damage, we can easily reverse it. But when you ignore the damage and you know that you have a problem and you do not take care of it, or you continuously take drugs that insult the kidney, you're gonna end up like this. Those I repeat once and twice and many times again, those side road medication are no good, because we do not know the side effects of the medicine, yet we take them and they can cause kidney failure. What you see in her breast here, this is where the dialysis takes place, right there. In and out. We filter out her blood by a dialysis machine. She's from Bamenda, and this is what she does.